After my psychiatrist asked me how many drugs had I taken in my life, he diagnosed me with a drug-induced psychosis. My response to this was, "But doctor, what about all the head injuries that I have had?" His response was, "No, they don't matter. It's these drugs that are the issue. We need to give you this antipsychotic drug to battle that." Hi, I'm Layo the Leprechaun, and I share about my experience with a drug-induced psychosis. So, before I got diagnosed with a drug-induced psychosis, I had a lot of head injuries. To share a few examples with you, I used to play rugby, and in rugby, I have many of scars. I have one here, 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 and on top of all this, I got knocked out for 3.5 minutes, giving me a concussion for 2 weeks. Adding on to this, I have been punched several times, usually because people have jumped me, not because of me actually fighting, unfortunately. My most recent traumatic brain injury came after this happened, where I crashed a mountain bike, I broke a bone in my neck, got 3 discs that I placed in my back, had about 30 stitches inside and outside of my mouth. Have a look here for reference. And on top of all this, my mum recently told me that whenever I was very young, she was giving me a bath. And I fell off the bath, the top of the bath, and hit my head off the floor, nosedived. And she immediately ran to the doctor who was just down the street. She then brought the doctor up to the house, and the doctor could see me running about like a madman. And he said, "Oh no, if he's running like that, he's fine." Probably a good chance though that, it had an impact on my brain. Anyway, this is a lot of damage to my little poor brain, My brain is strong, but I have to give it the strength it needs, you know what I mean? I can't be putting it under this fucking hard time. Let's have a look at what Pubmed has got to say about this scientific journal. Accredited, approved, I don't know if that's the right word. Individuals with schizophrenia have a higher frequency of prior traumatic brain injury than individuals with other psychiatric disorders. I wonder if that had a contributing factor towards my psychosis. Probably. Do you have psychosis or schizophrenia and have experienced a traumatic brain injury? Please write down your experience in the comments. Now, it turns out traumatic brain injury, it doesn't have to be one event. It could also be lots of small, minor brain injuries. You could describe me crashing my mountain bike as being a traumatic brain injury. You could also describe me getting knocked out in rugby as a traumatic brain injury. But on top of that, I've had a lot of minor brain injuries. And that's why I actually believe that it was a huge contributing factor to me developing delusional paranoia, as I experienced the delusional paranoia probably like 7 to 8 months after I had the bike crash. On top of this too, I was given OxyContin as medication for my painkillers, and if you follow the controversy within the pharmaceutical industry, then you will know that OxyContin, it is causing so many people in the US to become addicted to it, and it is an epidemic, effectively. And pharmaceutical companies are now getting sued for producing this OxyContin. And this is what I got given for my painkillers. And it fucked me up so bad. Like, it was the worst drug I've ever taken. And I've taken a lot of drugs. And it was the worst drug I've ever taken at the time. And I've taken a lot of drugs. I'd actually say antipsychotics are worse than them. But it was so bad that I refused to take it, and instead I self-prescribed myself with weed. So without a doubt, the weed had a huge factor in the cause of my psychosis and the cause of the delusional paranoia. However, I believe that the traumatic brain injury is equally as important. And so yeah, have you had a minor brain injury or a traumatic brain injury? Write it down in the comments. Let's have a further look into the science of the effect that traumatic brain injury has on your mental health. The study of schizophrenia and of the core symptoms of the disorder, such as negative symptoms, hallucinations, delusions, suggests that abnormalities in the structure and function of certain brain regions play a role in the genesis and maintenance of these core symptoms. The key brain regions include the dorsolateral prefrontal cortex, temporal lobe structures, basal ganglia, thalamus, and cingulate gyrus. These brain regions are commonly injured in many patients with traumatic brain injury, suggesting a possible mechanism underlying the observed link between traumatic brain injury and psychosis. What about that? In psychosis, the same part of the brain that is injured is the same part of the brain that would be injured if you had a traumatic brain injury. So there is a link. Yeah, the likes of Gabor Mate and Fritzi Horstmann, they are both very interested in childhood trauma, and they have both found that people suffering from mental illness later in life and those that are convicted criminals, they both have experienced traumatic brain injuries whenever they were a child. Now, there is a possibility that if you have psychosis or schizophrenia and you think that you have not experienced a traumatic brain injury, then ask your parents if you ever had a fall whenever you were younger, because there's a chance that your brain may have been damaged then. Now, don't go blaming anyone if this has happened to you, because, it may not be their fault, and it may also not be your fault. However, it is still your responsibility to deal with it. Going around blaming anyone is not going to make this whole process any easier. Taking responsibility and going out to find solutions yourself, this is the way that we are able to recover successfully. I want to reference Dr. Daniel Ayman here to support this hypothesis that there is a link between traumatic brain injury and psychosis. Have a listen to his TED Talk here.
Here's a scan of traumatic brain injury. Your brain is soft and your skull is really hard. Or drug abuse. The real reason not to use drugs? They damage your brain. Without imaging, psychiatrists then and even now make diagnoses like they did in 1840 when Abraham Lincoln was depressed by talking to people and looking for symptom clusters. Imaging was showing us there was a better way. Did you know that psychiatrists are the only medical specialists that virtually never look at the organ they treat? Think about it. Cardiologists look, neurologists look, orthopedic doctors look, virtually every other medical specialties look, psychiatrists guess. Before imaging, I always felt like I was throwing darts in the dark at my patients and had hurt some of them, which horrified me. There is a reason that most psychiatric medications have black box warnings. Give them to the wrong person and you can precipitate a disaster. Our imaging work also taught us that mild traumatic brain injury was a major cause of psychiatric illness that ruined people's lives, and virtually no one knew about it because they would see psychiatrists for things like temper problems, anxiety, depression, and insomnia, and they would never look, so they would never know. Here's a scan of a 15-year-old boy who fell down a flight of stairs at the age of 3. And even though he was unconscious for only a few minutes, there was nothing mild about the enduring effect that injury had on this boy's life. When I met him at the age of 15, he had just been kicked out of his 3rd residential treatment program for violence. He needed a brain rehabilitation program, not just more medication thrown at him in the dark or behavior therapy, which, if you think about it, is really cruel. To put him on a behavior therapy program when behavior is really an expression of the problem, it's not the problem.
Wow, it's pretty incredible, isn't it? From this scan, he's able to see the change in the structure of the brain after a traumatic injury. It was actually this TED Talk that really changed my whole perspective on my psychosis recovery. And his advice on how to give yourself a healthy brain, I fully believe that this has been pinnacle in my psychosis recovery. Ever since watching this TED Talk, I have made it a priority within my day to give my brain the healthiest life that it can possibly have by giving myself all the opportunities to make my brain as healthy as possible. Now, he explains you can make it as healthy as possible by doing the likes of meditation, exercise, writing, prayer, diet, socializing, communion, okay, maybe not communion, communal, that's what I meant. You know, if you have experienced this, or if you've experienced something else, even if you just experienced psychosis and you don't think you have experienced a traumatic brain injury, from looking at Daniel Ayman's brain scans, you know, you don't have to get a brain scan yourself, but you can take his word for it that you've got an unhealthy brain at the minute and it needs healing. So, what can we do for this? We can give ourselves the healthiest brain possible. And that is what I'm asking you to do, leprechauns. Go out there and give yourself the healthiest brain possible. Say no to drugs, say no to alcohol, say no to unhealthy and toxic things, and give your brain the love, compassion, and respect that it needs. Give it all of the love and the health that you have, and yes, we can recover together. Thanks for watching, Leprechauns. If you'd like me to talk about any other topics, then write them down in the comments. Thank you so much for listening. God bless.